passion for my job is unreal.
Yeah.
I sometimes get like in my own head and freak out about things because of my passion so deep for this.
Yeah.
And my wanting to impact people's lives, how mine has been impacted.
Yeah.
So yeah, every day of my life, I'm thankful for my donor. I wouldn't be here without them.
It's an incredible story, and a lot of folks have these stories. Let me take a break. When we come back, we're going to continue this conversation with some folks from the Mid-South Transplant Foundation who are joining me in studio this morning. Zola Burgess is the Community Outreach Coordinator and Family Care Advocate, and Kellie Dear, the voice you just heard, is a liver transplant recipient. It is extraordinarily important, ladies and gentlemen, and we all have a role to play in helping our brothers and sisters, especially when they're going through life-affecting issues. Let's take a break and pay a couple of bills. We'll come back on the other side. This is the Tuesday edition right here on WLOK. WLOK.
Then she was stunned because she had, when you having liver failure, you would, not able to rid yourself of the toxins in your body because they all can store right here in the liver.
Uh-huh.
So with her, you're not able to go to the restroom, but with her, your belly started growing. And her being so slim, of course she's going to notice that.
Yeah.
Belly started growing.
Yeah.
And as she mentioned earlier, she had ascites, and that's fluid. And when she had to go and get her belly drained, because it's like you just carrying around a big pouch.
Right.
But she has to go and get it drained.
Yeah.
And that lets you know that you haven't too many of those done, then you need to get a little further and get on that transplant.
We need to go deeper.
Absolutely.
Because there's clearly a problem there, and in terms of that too, seeing things that are happening, and one thing I want to mention about kidney transplants versus liver transplants.
Yes.
You can take a piece of a liver,
yes,
transplant it into someone else.
Yes.
So talk a little bit about that. I find that to be fascinating.
That is just like living donation. One thing I want you to know is that the liver, you have a person that's in kidney failure. And, kidney failure can be caused by so many different things. Glomerulonephritis, it can be caused by diabetes and hypertension.
Sure.
So, therefore, when you go into that, you can go on dialysis. But there is no dialysis for
the liver.
There's absolutely no dialysis for it.
Right.
But with the liver, we call that a liver related, because we'll take a little bit off of the left side, and we will take a little bit and we would transplant another person, because the liver is the only organ that actually generates. So it generates within 6 weeks. So it goes back to its normal size.
Yeah.
So,
and then it's the only organ that can be generated.
That's the only organ that can actually be generated.
Yeah.
So you can be a living, related, or non-related liver. Absolutely. And it doesn't cost you anything. If people want to think it doesn't cost you anything. But you can definitely save another life.
Yeah.
And your liver just grows back.
Yeah. And that's just a miracle of the human body, I think. It's amazing. And Kellie, she was telling her story. I mean, obviously, when you think about the past and you think about what you went through to get to where you are today, it can be a very emotional situation. You go from living what you felt was a very normal, regular life to all of a sudden dealing with a life or death situation in terms of all of that. And as you said before the break, you've devoted your life now to making folks understand through your experiences what this is all about, correct?
Yes. So kind of more than just ascites. I couldn't walk. My body was toxically poisoning itself because I could not. My liver was not functioning hardly at all.
Mm-hmm.
So I couldn't walk. I sometimes didn't even know my name. I locked myself out of my phone numerous times at the hospital, and it was a lot. Like, now, I mean, I could work 24-hour shifts. I am mentally sharp. I
Physically feeling pretty
physically, I could run around dog show ring again.
well? Oh, okay. Yeah.
I exercise. I go to the gym almost every day.
So this is less than a year ago, right? Correct?
8 months ago.
8 months ago that this happened. In terms of that, when you were at a very critical stage in all of this, and you found folks at Methodist, when you know in all of this, how close were you? How close did the doctor say to you that this needed to happen yesterday? I mean, how close were you to death, if we will, in terms of what you were dealing with?
Well, I almost died 3 times in Baptist.
Okay.
Those guys saved my life too.
Mm-hmm.
Methodist, it was, I mean, I walked in, there was 174 people on the list. I walked in on number 2.
Oh,
I
wow.
was that serious.
Yeah.
And every time they had a liver, I was there in the hospital getting prepped for it.
Mm.
So, I mean, it was pretty close. I mean, I was every other day getting blood work done.
Yeah.
Like I said before, I mean, I practically lived in the hospital.
Yeah, it got to be beyond critical, is what I hear you saying. Zola, in terms of the numbers, and she said there were 174 people in front of her. So clearly there is a big difference in terms of individuals who are dealing with the kidney side of things
Yes.
versus the liver side of things.
Right,
Not
right.
quite as many, but still a number that deserves to get some merit here, isn't it?
Absolutely. It's like, Chip, look on the kidney list. We have maybe approximately 1,600 on the list. And these are people who've gone through the whole process of getting themselves listed and all of that. Okay, but listen to this. How many donors did we have this year? 96. That's really, really, really low for all the deaths that we have here.
Yeah.
So I want to know, what happened to all those organs? They went to waste.
Yeah.
Now, with the liver, it's a little bit different. We go by MEL scores, and it's according to how high your MEL scores is. Like Kellie, hers was extremely high, so she got to be number 2.
Sure.
So what we look for in organ donation, we don't look for anyone to die. We try to save each and every person, but we try to take the sickest so that we can transplant.
Sure.
So her being number 2, she was pretty sick.
Yeah.
But I want everybody to know the difference in organ and tissue. Organ for as the kidneys. If you enter dialysis, my guess is I would love for you to ask the social worker, how do I get on that transplant list?
Right.
Because that transplant list doesn't go like Kellie's. It didn't go by any scores. It go by how long you've been on the list. So it didn't go by the sickest, because everybody on dialysis is considered acute.
Yeah, right.
So you need the time you get on there, you need to get on there so that you can get your time in, and your time will come.
Yeah. That's very interesting, for people to really understand, and just what you said a minute ago about the absolute and incredible need of individuals in terms of being on these lists is extraordinarily important. And this is why you have so many people that are waiting, and they are acute. Go ahead, Kellie. What were you going to say?
I have something to add to that. So this is a huge part of my story and a huge part of what fuels my fire for making a difference in transplant.
Sure.
I have a really good friend that was listed on the same day as I was with a liver.
Okay.
So it's all about donors, right? But I was a A blood type. She was an O blood type.
Right.
I had 8 offers before I got my good liver. She had 2. And she got her liver 4 months later than I did. And she never woke up. She did not make it out of the hospital after her surgery.
Oh, goodness.
And so if she would have gotten an O liver 4 months before, she would still be here to talk about this.
Yeah.
So normal people on the street, normal people living everyday life don't really know what their blood type is.
Yeah.
I didn't before I went through all this.
That's a very big deal. Yeah.
So, organ donors is a big thing, but the more donors we can have out there, the more blood types we have available for livers for people that need them. And so her, diagnosis was not alcohol related. It was, totally different.
Yes, sir.
And it fuels my fire trying to help get more donors for situations like that.
Yeah. And that's a whole nother thing. There's always a demand for blood. There are different types of blood in reference to all of this. Need to take another break. And if you're just joining us, we're talking today about organ donation and how extraordinarily important it is for all of us to think about it and consider being a part of all of that. When you leave this earth, and that is guaranteed that you are not going to live forever, you're going to leave this earth. What are you leaving behind in reference to other individuals? There are so many people who are still left here who could use a piece of your body that is no longer functionable for you, but could save somebody else's life. And we're talking about that this morning. If you have something you want to weigh in on in terms of this, you can always call me at 901-888-6805. Zola Burgess is in with me this morning. She's the Community Outreach Coordinator and Family Care Advocate. And Kellie Dear is a liver transplant recipient and advocate, both for the Mid-South Transplant Foundation. Let's take a quick break. We'll be back on the other side. This is the Tuesday edition on WLOK.
Need a little extra to make big things happen? Whether it's a new car, home upgrade, or unexpected.
An organ donor. And I, to this day, I would say that in terms of my life, that's probably the biggest thing that I will ever do on this earth. And I was happy that the Lord allowed me to be in a place where I could donate a kidney. Now, we have there's a pairing program that they utilize too in all of this, and my wife had kidney disease, and then for a long time, and it had gotten to the place where the dialysis was right around the corner. We both decided that that's not something that we really wanted to do because it's sort of like waiting to die, I think, in my thought process. So I basically asked the doctors, I said, well, what can I do? I mean, it has gotten to a place where, how you ask for people to go get tested, right? To see if they could be a donor. And there were no blood type matches, and everybody we asked, they got tested, and it didn't match. I didn't even match. But then it came down to what can I do? And you talk about, you mentioned it earlier, this is look, for me, it wasn't any great feat or great deed. It was something that had to be done. And if something has to be done, you do it, no matter what. I had to end up losing some weight. I had to lose about 30 pounds. And you're right, when they test you, they test you and test you and test you and test you. It's a big deal in all of this. And finally, all the stars aligned, and what happened was I gave a kidney to an unknown recipient in order for my wife to get a kidney from that same that pairing program. So we both had surgeries on the same day. I went in at 5 o'clock in the morning, and they took my kidney and they shipped it off to whomever. And at 5 o'clock that afternoon, she received a kidney, and been 4 years now, and everything is wonderful. But again, Zola, you make practical sense of the fact that there really isn't any excuse for all of us to think about, because we don't think about people the way we should in terms of all of this until it personally affects us. But I mean, this could go into effect years from now for somebody who needs it in terms of you giving, if you're, especially, when we're leaving this earth, right?
Yeah, absolutely.
Yeah.
Because we all have assigned time.
Yeah.
I'm just a believer in that. People don't. We all have an assigned time. But Chip, I would love to get on this pairing program. That is something that is simply amazing.
Yeah.
If you don't match, you can get in the pairing program, and then you may not match your potential donor, but you can match someone else.
That's right.
So it's a swap.
Yeah.
We used to call it swap program.
Yeah.
And
That's
you
exactly
save
what it is.
lives
Yeah.
regardless If your loved one you don't match with them, you'll match with someone else.
Yeah.
So that's a great program because right now, our waiting list for the kidneys are 8 years. They will not.
8 years?
8 years. They will not. Dialysis is so rough on your body.
Yeah, it is. It is. Yeah.
So rough on your body.
Yeah.
You think of them draining the blood out of your system, taking it through an artificial kidney, which is a dialyzer, and then putting it back in your system. So I would say that 99% of the people that's on dialysis are in congestive heart failure because that pulls on their heart.
Yeah. Yeah.
So you can help somebody. What's that song say? If I can help somebody along the way, my living will not be in vain.
There you
So
go.
this is something that you can do.
Yeah, absolutely that. And I think we need to talk a lot more just overall about the pairing program because
Yes.
a lot of people can use the one option and say, well, we don't match blood types and you have to go on dialysis and all this other stuff. But again, the pairing program is a life-saving
Oh, it's a
mechanism.
life-saving.
People want to make a big deal out of sometimes when you say, well, I'm an organ donor. I don't go around talking about it. It's not a big, for me, it wasn't, oh, I'm going to be, it was, I need to, how can I save her life? How can I save another person's life? Because I would rather you live and me die, but doing something for somebody else. And I mean that from the bottom of my heart. And I'm listening to, Kellie, and a lot of times when life brings us these unexpected challenges, it takes a minute for us to be able to realize what is going on. You went through the procedure, you got you had a liver transplant, and now you are in your way, you're giving back now because of this life-saving procedure in terms of a donation. That has to be for you and an extraordinary feeling on a daily basis to be able to know that someone saved my life and I want to be an advocate for saving other folks' lives.
Yeah, for sure. Just on that note, I guess I love my job. Like, I love being there. Even though I work in tissue, which a lot of times tissue isn't talked about enough.
Sure.
So let's back up my life. I broke my ankle playing basketball before college, and I had to have a transplant in my ankle. So that's a tissue transplant.
Okay.
And my father had a quadruple bypass surgery, and that's a transplant of heart valves.
Sure.
There's professional athletes out there that have transplants of people's tendons and things that we don't think about every day.
Right. Right.
So not just organ, and obviously that's where my heart is, but tissue. It's impacting people's lives to be able to let them have a quality of life, to live their life normally. And so that's also a huge thing.
Yeah.
That I see every day.
Yeah.
So
Yeah, I mean, it's a very big deal. Zola, we've come a long way in terms of medical technology and research. What might have been more complicated and difficult 10, 20 years ago is a relatively simple process now in terms of these donations and these transplants and things. And I think I think a lot of people are mentally, are wondering about that part. Are they gonna cut on me, man? And and I don't know what's gonna happen with all that. But I mean, even to the place where people who have hepatitis can give kidneys as well. Talking about kidney transplants because of medical technology.
Yes, medical technology.
And they're continuing
Yes, because there was a time, because I've been in transplants for over 40 years, there was a time if you had hepatitis, but now they would give a pill and it can wipe the hepatitis away, like the pancreas transplant. Chip, there was a time when they would do pancreas transplant. Just in case you don't know, pancreas transplant is pancreas for the diabetics. And Lord knows we have a lot of diabetics.
Oh, yes.
Here.
Oh, yes.
We have a lot of diabetics.
Oh, yes.
So there was a time when we used to do pancreas transplants back in my clinical days, and that transplant would not stay. If most patients would say, More patients, family would tell me that transplant when they went to the restroom, it bottom out in the toilet. We have really perfected this thing now.
Yeah.
So we have so many pancreas transplants that's living today. So many of them.
Yeah.
So, we want to just open our eyes to all the waste that we take, as you say. I want to take them with me when I die. Where you going? So we really want to understand that organ donation, you can allow that legacy to live on. Your family will get a chance maybe to meet that person who saved your life.
Yeah.
You never know.
Absolutely. Now, you've been on this road, as you just said, over 40 years.
Yes.
What brought you to this road?
It was a hiccup, to be honest. I needed a job. So I got a job at UT and stayed there for a minute. And they said, oh, you need to go over to the surgery department. And that's where I landed, the surgery department. And I was very excited to learn something new. Then they said, well, can you go over to run that surgery clinic for us? Sure, because I was young, hyper, and I did that for 10 years.
Okay.
Until my two sons went off to college. But after that, then I went over to Mid-South Transplant. And I've been there for 25 years.
Bless your heart.
So it's been a long road, but it gets more and more exciting each and every day, because when you see a person as sick as Kelly, but on the other side, my Lord, looking good.
Looking good.
Looking good.
And feeling good, too.
Yeah.
Let's take one final break, and when we come back, we'll wrap up this Tuesday edition. We're talking about transplants and the importance of them, and more importantly, how you can be involved in helping to save someone's life. It really is as simple as that. We're speaking with Zola Burgess. She's the Community Outreach Coordinator and Family Care Advocate for the Mid-South Transplant Foundation. And Kellie Dear. Kellie is a liver transplant recipient, and she is also an advocate for Mid-South Transplant. And if you've been listening, as you heard her say a few minutes ago, she did this. She wouldn't do anything else. She didn't want to do anything else. This is a passion for her. This is her life's work, her life's mission now. So we will take a break on this, pay some bills, and we'll be back to wrap up the Tuesday edition. If you want to call this morning and you have something you want to maybe, and also works with Mid-South Transplant as an advocate. Let's take a phone call this morning. Go ahead, caller, you're up.
Good morning, Chip, and to you guys, y'all have a beautiful conversation going on.
Yeah, we do.
I show you what love will do for you, because if you love somebody, you do all you can for them. Jesus Christ loved us, and he gave his life for us. And we don't love nobody, and we're trying to killing somebody. I think it's so sad how that man did that woman up here in Minnesota. She made like she was trying to threaten him, but the car was going away from him. We can so easily lie, but God sees all, and we're going to pay for our wrongdoing. I think that's so good what y'all are talking about today. I had head surgery 24 years ago. I had a stroke and my blood pressure went up, and I had to have surgery to get my head from stop swelling, then it was going to burst. So they did surgery on me. A beautiful doctor named Dr. Phil from New York did surgery on me, and that's been 24 years ago, and I'm alive with the top out of my head. So we should try to give life, not take life.
Absolutely. Thank you, Mother Martin. I appreciate those kind words. That's good stuff.
All right, we should
do
better here in this world, because it belongs to God.
Absolutely. Thank you for the call. I appreciate that. Thank you.
All right.
All right, bye-bye. When you hear that, and I'm watching, Zola and Kellie listening to this, there is something very, I can't find the word I want to use, but in terms of helping someone to continue to live life, there's just something very, to me, magical about all of this. And if you've heard this show, you've heard the passion that these two are exhibiting about this, because this is very real. This is real life. This is a life or death proposition that all of us are in. But the good news is that we have an opportunity to be able to change someone else's life who is struggling as well. Let's take another call. Go ahead, caller. You're up.
Hey, how's it going, Chip? How are you to your guests as well? I just wanted to say that I think this is very important work. It's definitely become important work for my family, because we've had a family member that just got on dialysis, and her kidney began to fade in its percentages of use due to COVID, right? And also being a diabetic. And so this has been something new for our family, and we're having discussions about it right now, about, who from within our family, if it comes to that point, if the cells do not regenerate, because now we're trying to see if this temporary dialysis that she has recently started will help regenerate the cells of her kidneys. And we're talking about other options, like who in the family is going to donate their kidney,
Right.
so that she doesn't have to wait for 8 years.
Right.
Those are the discussions that we're having right now.
Yep.
And so this is very important work. And then I think it's important in our country to talk about, like, why do we have so many folks on dialysis? Like, what's going on with our food? What's going on with this commercialism that feeds off of making money off of people selling them bad food and getting them to have these habits of eating these bad foods over years? Because it takes years for you to, get in this condition of years of poor eating habits is what I'm getting at. And so I think we need to talk more about that too, so we can minimize the amount of people that are on dialysis. Thank you for this important work. Thank you, Brother Chip.
Thanks, man. And again, Zola, the more times we talk about this, the more times we can hopefully encourage someone to at least ask the question about, you hear the statistics, you know the numbers, they're very high, and maybe ask, what can I do to help? Maybe this is that encouraging note, I think.
Yes, what can we do to help? And like the young guy said, we can do some things ourselves. And, we can definitely change our diet. We don't have to eat so much salt.
Mm-hmm.
We can definitely drink more water. I hear so many people say, I don't drink water. How do you flush your kidneys?
Yeah.
How do you flush the toxin and things like that out?
Yeah.
If you're not drinking water. And because we refuse to cook and eat at home.
Mm-hmm.
We refuse to do that.
Mm-hmm. Mm-hmm.
That's something that we can do.
There are a lot of things that are involved in it, and Kelly, as someone who is a transplant recipient, and again, we don't talk a lot about the liver, and that's why I'm glad we're having this conversation this morning, because that is another aspect. You work in tissues. There are a lot of ways that we can contribute in terms of that as well, right? So, and these are important things to continue to inform you. It's like I sense it. I see this passion in you. You're like banging the drums. I know what I'm talking about. I've been through this, and it's a very important component.
Yeah, so talking about eating, I guess, is like, through my sickness, I had to drop all salt out of my diet. I had to drink water. I couldn't drink dark sodas. It was very strict on how I had to eat.
Sure.
And I could tell the difference on how much I swelled with my ascites on if I ate something I shouldn't have eaten.
Mm-hmm.
So yeah, diet is a big thing with controlling stuff, but I mean, it's kind of the whole circle of it,
Mm-hmm.
So yeah, I mean, my passion within is so deep that, the amount of stuff I learned through this whole process is just unreal.
There's a lot of things that we need to continually learn, Zola. That's why I thank God for you and a lot of the folks over, and you and Kelly both over at the Mid-South Transplant Foundation. But information is power.
Absolutely.
And we can't if we can't perform, or we can't do what we need to do if we don't know. Correct?
Absolutely. We can't perform what we don't know.
Right.
But there are so many things out. You can go just barely everywhere, and you'll see some information about organ and tissue donation.
Yeah.
So, and don't tell me that you don't have any information, because it's out there.
Yeah.
We have TV commercials. We have everything that talk about the importance and how you can make a difference.
Absolutely that. And, again, my hour's up, but I really appreciate you both being here, first of all, but more importantly, the work that you do on a daily basis to help save other folks' lives. Because as I said before, there's a difference between being selfish and selfless. And what you're doing is selfless work. You know, I mean, it's not just, you say it's not about me. It's about you, and it's about your family member. It's about your friend, your colleague, your coworker. It's about so many folks that need help that you don't know that they need help.
Right.
And we just need to bang the drum, and that's why I'm gonna have you guys in often, because I've noticed in this city, the more you talk about something, eventually somebody's gonna get it.
Somebody's gonna hear you.
And somebody's going to hear you. And I know that because of the hard work that you all do over there, that this is going to continue to grow. And I know the word is out more and more and more. And it's going to grow and grow and grow. Thank you, Zola Burgess. Thank you, Kellie Dear, for being here with me this morning. I truly appreciate it.
I'm going to leave a word with you,
Absolutely.
Chip, with everybody. And this is a real thing
There are
here.
certain dreams
We say
you should
our
write
slogan,
down.
don't take your
Because dreams
organs
are
to
designed
heaven,
for you to
because
get it.
heaven
Most of my
knows
dreams
we
say
need them
wants
here.
you to get it.
Amen to that. Look at that. That's how you close the show, ladies and gentlemen. I appreciate you both. Thank you all so much for being
Thank
here.
you for having me.
Boy, this is a wonderful hour. I hope you had a chance to listen to it this morning. My time is up, and we are going to get out of here. But again, thanks to all of the fine folks over at Mid-South Transplant Foundation. Tell Randa I said hey. I know she's probably listening this morning. So listen, go out and make it a great day, ladies and gentlemen. And watch out for yourself and watch out for other folks, because they may not be watching out for you. If the Lord says so, I will be back here tomorrow, same time, same station. We'll try to do it again just a little bit better. And again, once again, be